Hello, I'm Donna Meltzer, and I am CEO of Brain Injury Services in Northern Virginia. It's March, and March means that it is Brain Injury Awareness Month. And throughout this month, we're taking this opportunity to highlight so much about what brain injury is, what it means for people who live with brain injury, and we are partnering with others in our community where they also serve individuals who struggle with brain injury and related conditions. Today, I have a guest with me, and I am excited to introduce her. Her name is Suzanne Coyle, and she is the Executive Director of the Stroke Comeback Center. I've invited Suzanne today to join us for this conversation during Brain Injury Awareness Month because stroke is very much connected to brain injury. And we're going to get into a conversation about that. So, Suzanne, welcome. We're so happy to have you with us today.
Great. I'm happy to be here. Happy to have this conversation.
Terrific. Suzanne, why don't you start by sharing with our audience a little bit about the Stroke Comeback Center, what it's about, how long it's been around, and how long you've been with the Stroke Comeback Center.
Sure thing. So the Stroke Comeback Center is a nonprofit organization. We are based in the Washington, D.C. area. We have our center in Vienna, Virginia. We have a center in Rockville, Maryland. And then we have a very active virtual center that is open to residents throughout Maryland, D.C., and Virginia. So we were founded in 2005 by a speech language pathologist named Darlene Williamson, who knew that stroke survivors, particularly those with aphasia, had the opportunity to continue their recoveries far beyond what traditional rehabilitation services were covered in hospitals. That as insurance limitations really restricted access to therapy, she knew that these people had the opportunity to continue their recoveries, but there was no place for them to go. And that was kind of the idea that started Stroke Comeback Center. And back in those early days, she started the programs with a handful of survivors and a lot of hope. And it really took off and grew and grew. I joined the organization in 2008. Before that, I had been working for MedStar National Rehabilitation Hospital in their outpatient program. And I saw what Darlene saw too. I was so happy to finally have a place that I could send my patients when they finished their work in outpatient rehab, because I knew that there was so much more recovery possible. So I've been with the organization since 2008. Since then, we've grown. We moved from Oakton, where we started out, to here in Vienna. We did that in 2009. In 2018, we opened our Rockville Center. 2019, fortunately, we started virtual classes that carried us through the pandemic years. And now we're on the other side of that. We still have our virtual programs. We still have our two centers. We have an active family and caregiver group, and we've really evolved far beyond just supporting communication changes to now we offer adaptive exercise classes. We have an art class. We have a very active family and caregiver group. We have social events throughout the year, and we really operate like a community center to support stroke survivors. And the big thing that's different about us from a lot of other programs people might find is that because we're a nonprofit, we never turn away anyone for financial reasons. And that's something we're really proud of, that we've held true to
As you
that.
should be, and it's so important in this time right now, especially.
Absolutely. Absolutely.
That's great.
Yeah.
Thank you for sharing all of that history and a little bit about where you're located. You
hmm
are certainly in the DMV, as we
hmm
call it up here, right? And so there are many ways that people can connect with you. I wanted to touch on something you said. You talked about, or you used the word aphasia. Let's
Yes.
explore that a little bit because maybe not everybody knows what aphasia is or how it presents and how it connects to brain injury as well as stroke.
Absolutely. So aphasia is a language disorder. that is most often the result of an injury to the brain. In most people, language is in the left side of their brain. So if they have a stroke or a brain injury in that left side of the brain, it's likely to impact their language. And aphasia impacts all aspects of language. So they're talking, they're listening, they're reading, and they're writing. But most importantly, aphasia does not impact somebody's intelligence. So you can imagine it'd be very frustrating. You have all the same knowledge that you had before your stroke or your brain injury, but now suddenly you have trouble communicating your thoughts. You have trouble understanding what people are saying to you, and you can't necessarily use reading or writing to help you through it. Um, the good thing is aphasia does get better. And there are lots of ways we can help support people with aphasia. And like I say, if that aphasia is a result of a stroke or a brain injury, we expect that it will can improve with time and intervention. I do just want to bring up, there's been a lot of talk about aphasia in the news in the last few years with some celebrities that have had aphasia, like
That's
Bruce
right.
Willis,
Mhm.
which you may have heard about. And his aphasia is different because aphasia can also be the result of a neurodegenerative disease, which can lead to what we call a frontotemporal dementia. And that's a very different pathway for people with
Mhm.
a progressive aphasia. So just always like to have that distinction between the two types.
Yeah, that's important. Thank you
Mhm.
for that. So, if somebody is at home with their family or friends and they see some signs in a loved one, a friend that strikes them as something's off kilter,
Mhm.
what are those signs? What should they be looking for that might signal either that a stroke has happened or aphasia is presenting, or, what should people be looking out for?
Absolutely. There's a great acronym to help you remember the signs and symptoms of stroke, and
Mhm.
that is B FAST. So what we're looking for here is a sudden change with all of these letters. B is a sudden change in someone's balance. E is a sudden change in someone's eyes or their vision. Um, F is a sudden change in someone's face. That's one of the classic symptoms of a stroke when they have one side of their face that becomes weak or drooped. A is a sudden change in someone's arms, particularly arm strength on one side of the body or tingling, numbness on one side of the body. Uh, F A Arms. S is speech. As a speech pathologist, that one should have been top of my head. Um, and that can be a change in somebody's clarity of speech, their ability to think of words, or their ability to put words together in a way that makes sense. Most importantly, though, T is for time. And it is so important that if you see even one of these symptoms, that you call 911. And I just can't emphasize that enough, that it's so important to just get that stroke protocol started as soon as you make that 911 call. And that's because there are these amazing life-saving and disability preventing treatments that are available to people experiencing a stroke, but they have to be administered very quickly, usually in 3 to 4 hours after a stroke begins. So if you think about the amount of time that it would take to get to the emergency room, to get evaluated, to get all your screening and scans and everything that you would need to take place so that you could have one of these treatments, 3 to 4 hours is not a lot of time. So don't mess around, just call 911. Don't drive
That's
yourself or drive someone else.
right.
Yes.
That is great advice. So be fast. I
Yes, be
love that. That's
fast.
easy to remember
Mhm.
and so critically important because getting there
Absolutely.
quickly can save a life, or really help somebody so that they don't get into, I don't want to say a worse situation, but
Oh, yeah. Outcomes are so much
yeah,
better the faster you get
right.
medical treatment. And we always say it's a good day if you get to the hospital and it's not a stroke. That's good.
Oh, that's fantastic, right?
Yes.
So, where does it kick in? So, let's say somebody does get to the hospital on
Mhm.
time and there has been a stroke, and I imagine they go through some medical care and some recovery. When is the right time for them to reach out to the stroke comeback center to say, okay, I've finished my medical
Mhm.
visits, etc., but I'm still not feeling okay? I don't feel like myself. Is that the right time for them to reach out to you?
Yeah, I mean, that's a great question. Um, what we usually recommend is anytime somebody feels like they want to be doing more than they are currently doing, that's the time to call us.
Mhm.
And sometimes that is when someone's in outpatient therapy and maybe their therapy visits are going from 3 days a week to 2 days a week, and eventually they'll go down to 1 day a week. But they have all this other time throughout the week. They're used to doing all this therapy all the time. That's a great time to call us. Or when therapy has ended and they're sometimes people like a little bit of a break. It's a it's a full-time job to recover from a stroke or a brain injury. Um,
Yes.
so whenever they're at the point that they want to be doing more than they are doing right now, that's when to give us a call. Because we don't participate in any insurance programs, it's never a conflict for somebody to be in our programs and also be using their Medicare or their private insurance at the same time.
That's really great to know.
Mhm.
I had a wonderful opportunity. You invited me last summer to come
Uh-huh.
over and see what was going on in your space. And boy, it was hopping.
Yeah, it's busy
Lots
here.
of people were there for a
Yeah, yeah.
variety of different opportunities, things to do. I know one of the things you're really big on is something that's important in my own life, which is yoga.
Yes.
About this connection about yoga and stroke and brain injury and how yoga can be one thing of many others that you might want to talk about as well that really support that journey to recovery.
Yeah, absolutely. So we started a yoga program many years ago as just as a trial. Is this going to work? And what we found is it really does work. So we have an adaptive yoga class, and it's open to all levels of physical ability and all levels of communication skills. And so some people participate seated in a chair. People that are able to may get up and down off the floor, but it is really using those yoga mindsets of meeting yourself where you are, accepting what your practice is today. And it incorporates a lot of mindfulness and a lot of body positivity, accepting this is what my body can do today, much like a traditional yoga class. There's a reason we call yoga classes practice, right? So you come with your beginner's mind, and I think it has really become a really nice way for people to get back into movement, and and again, that mindfulness piece of quieting your mind is so important too. The nice thing that we've seen through the years as we've had these adaptive yoga classes is it also has this unintended and wonderful outcome of it giving people more encouragement and the ability to go join a community yoga class. And that's something that they might not have done if they hadn't been in this protective, welcoming space of one of our adaptive yoga classes. So it's always kind of bittersweet when someone says, I'm not going to take your class anymore because now I'm going to take it at the Y. I'm going to take it at my community center, at my
That's
gym.
success,
But it
right?
is, right? I was
It
just going to
is.
say that's success. We want to give people those stepping stones so that they can get back into their communities.
Right.
Um,
That's something we talk a lot about at Brain Injury Services, belonging, right?
yes,
Our buildings, our facilities, the places where people can gather really is probably one of the most important things as part of that journey to recovery
mhm,
is feeling like you have a place where you belong. You've got your
yes,
people. You've got that safe space where you feel like you can just be yourself and in all your imperfect glory,
mhm,
and everybody understands who you are and what you're doing. But I think to see somebody say, oh, I can't come to your yoga class because I'm going
yeah,
to the Y is exactly the result that we're all looking for is getting our folks back
absolutely.
out into community and living their best life.
Absolutely. We always say it's a good thing when someone gets too busy for us. When they're like, I just can't fit that book group in my schedule anymore because I'm doing so many other things. Like, that's great. We miss them here, but we want people to be out in the community living their lives.
Yeah. Do your clients have concern about maybe having another stroke or another incident that might be problematic for them? And if so, how do you counsel them on that?
Yeah, that is something that comes up quite a lot because having a stroke certainly puts you at risk for having another stroke. And so we talk a lot about the ways that you can reduce your stroke risk. Um, if you have medical conditions that make you predisposed to stroke, like high blood pressure, high cholesterol, diabetes, making sure those are managed as well as you can. Living a healthy lifestyle with movement. So yoga is great. Having exercise, eating a healthy diet. So we talk a lot about the ways to reduce the stroke risk, but we also talk about the fact that you also still have to live your life. So it's really devastating when somebody in our program has another stroke and our members hear about it. But we do talk about, again, let's talk about reducing our stroke risk, but you can't sit at home, eating your celery and, you have, and trying to do only doing the things that prevent stroke. You
Mhm.
also still have to take
Right.
some risks. You have to take the vacation. You have to get back out in the world.
Yes. And family. Family's so important too. And
Absolutely.
family, friends, community. Do you have support groups, or how do you counsel or support the support system for the
Yeah.
folks about stroke?
Yeah. Well, we really believe that stroke impacts the whole family, as does brain injury. So much attention is focused on the survivor, but that spouse or family member sitting right next to them, their lives change dramatically that day too. So we do have a family and caregiver group, and they meet twice a month. It is run by caregivers for caregivers. Sometimes I will pop in for a certain reason, and then they're like, "Okay, go along. We got it from here."
Right.
Um, and it really is a safe place for them to talk about their experiences, their needs, and support each other. I'll also say there's no better group of resources than a caregiver support group. If you want to know, I mean, how do you go to get your eyes checked when you have a hard time naming letters because of your aphasia? Right. But they'll know which eye doctor to see. Or if you have problems following directions, problems with attention, weakness in your mouth, if it's going to impact your trip to the dentist, they know which dentist to work with. So a caregiver group is a tremendous resource for people looking for referrals.
Excellent.
Mhm.
When we began this conversation, you mentioned that you do provide your services at very low cost. It's very
Mhm.
affordable for anybody who needs it. Talk to me a little bit more about where your funding and support does come from. Are you dependent on any government agencies, or, do you need to be advocating for funding the way we do at Brain Injury Services? Share with us how it all happens.
Yeah. So our funding sources are different than yours at Brain Injury Services. We get some support from private foundations. We get some support from individual donors. We do get some support from Fairfax County. We don't have state or federal funds, which right now makes us feel a little bit more secure, I think, than some other organizations. I say for better or worse, we don't. We have member fees that make up a portion too. And then we have our fundraising events throughout the year. And that's an important way to keep our doors open and keep our services affordable for everyone. And most importantly, support our scholarship program, which is based on household income and need.
Great. I believe you mentioned to me that in May you have a big fundraiser coming up. Tell
That's
us
right.
about it.
We do. So I said at the beginning, we were founded in 2005, which means this year's our 20th anniversary. So we're really excited about our celebration that we're having on May 8th. And it's going to be at the Center for Education at Wolf Trap. And it's going to be, it's going to be a big party. We always say we work hard, we play hard. So now we're going to play hard. It's going to be a lot of fun. We're going to have an opportunity to look back at all that we've accomplished, and most importantly, our members have accomplished over the last 20 years, and get us ready for the 20 years ahead. So we're really excited about that.
That sounds great. How else, Suzanne, can we be partnering between brain injury and stroke?
Yeah, well, there's so much overlap in the needs of a stroke survivor and a brain injury survivor. Depending on where in the brain the injury occurred, depending on where in the brain the stroke is, they can look very, very similar. And what's great about having our two organizations here in the same area is that we can serve these survivors with the programs that we have here that support communication and physical changes after a stroke, and our caregiver program and all of that. But you all offer so many wonderful services that we don't offer. So it's a nice way that when for example, case management. When
Mhm.
we have someone in our programs that really needs case management, it's great that we can refer them to you. And when they need the services in your clubhouse, we have a lot of people that go back and forth. They might
Mm,
work
mhm.
with us on a specific skill here in a group, and then are in your clubhouse program. So it's really nice that we can work together to meet their needs.
Oh,
And
yeah.
we don't have to do it all. Neither one of us
Right.
has to do it
That's
all.
right. Right. We each have our individual niche, but we come together and we can share those resources. And yes, it's nice to say, I don't have to do it all. I have
Yeah,
partners in the Northern Virginia community and beyond. So
absolutely.
that is certainly very exciting. Where do you see the Stroke Comeback Center, say in 10 years? What would growth look like for you? Or what do you think you might be doing differently? So much is changing in our world rapidly with
Hmm.
AI and so many other things. Like, tell me what your vision, your long-term vision looks like.
Yeah, I think if anything, the last 5 years have taught us that long-term visions are they're great, but the world may have a different plan for you.
That's
Um,
true. The pandemic certainly taught us that.
yes, yeah, you thought you had a plan. But if I, could dream about what the next 10 years would bring, I would love to bring this support into different communities. I mean, I think every community should have a stroke comeback center. Every community should have a brain injury services. Every community should be able to support survivors throughout their recoveries with the wide variety of needs and goals that they have. Um, One thing we're thinking a lot about here is how we can maybe better use virtual programs and expand our reach. There's an effort on the national level to make state licensing easier for professionals. And as that program works its way through, we might be able to expand our virtual programs into other states, which would be really nice. And then I often think too about the power of being together in person and how do we bring that into an underserved community. So can we work with another organization that maybe has a space that we could just be in for a few hours a week, bring people together? It doesn't have to be like our Vienna and our Rockville centers where we're owning a space 365 days a year. But how can we bring that connection into communities where we're not now? So I would love to have little pockets of stroke comeback centers all over the place.
I totally understand that. I mean, we're having this very same conversation with brain injury services and our counterparts around the Commonwealth of Virginia. We like to say we're a unicorn because Virginia is one of the only states in the country that actually has every square inch of the state covered with a brain injury service provider.
That's amazing.
And it is amazing. And I think it's really something to shout out about. In fact, last week we were on Capitol Hill for Brain Injury Awareness Month with the Brain Injury Association of America. And we were doing visits and we were meeting with staff from the office of our own local representative, Representative Jerry Connolly. And we started talking about that. And they said, we need to make this national. Your program in Virginia, what you all do should be national. So we're exploring that. We're
That's
really
great.
actually having conversations. How realistic it is right now, I don't know, but it's a great time and a great place to at least start that conversation. And I think you're so right, Suzanne, in that we're sort of walking this fine line between the knowledge and experience we had over the pandemic to know we can do great things virtually. We can serve
Yes.
so many more people, at least at some level. But on the other hand, there's nothing else like
No.
being in person.
Yeah.
There's nothing else that truly builds community in that
Absolutely.
way and gives your survivors, our survivors, that opportunity to not feel alone, to feel like they have their people, to feel like they
Hmm.
can sit one-on-one with a case manager or a friend
Yeah.
in,
Hmm.
the place where they're doing their work together. So
Hmm.
I think we need a little bit of both moving
Hmm.
forward. And I
Yeah.
think that's always worth, exploring and challenging ourselves about how we reach so many more communities. I think particularly underserved communities,
Yes. Yes.
where they don't have the resources that we've been fortunate enough to build
Right. But they
ourselves.
they don't, particularly transportation resources. I mean, that's one of our biggest limitations
Yeah.
is that even here in the DC area,
Yeah.
we had somebody that came to us using Metro Access, our paratransit service, unknowingly moved just across the county line, moved, a couple miles away into a different county and no longer had access to transportation to get here.
Yeah.
And um, what do you do at that point? He's moved.
Right.
And that's
Right.
pretty far away.
We've had that same conversation. In fact, a local delegate came in to meet with us one day, and she's got some plans she's working on in the state legislature around something that she calls last mile transportation,
Mm-hmm,
right? So
mm-hmm.
that metro system might get you from one community in Northern Virginia to another, but then you get off that train or you get off that bus, and then what? You still have another mile or two to go
Right.
to get to the place. And places like ours and yours, I haven't been to your Rockville office or, but I've been to your place in Vienna. It's not, in the middle of a bustling city where anybody can just easily get there.
Right.
We're sort of, in suburbia.
Mm-hmm,
So it's not so easy to get that last mile. And,
mm-hmm,
we know that there is metro access that works for many people,
mm-hmm.
but we need more opportunities
Yeah.
to help
Especially
people.
for people with disabilities, so they may be able to
Absolutely.
get all the way to our closest metro station, but then I think that's
Right.
2 miles from here.
Right.
So they have to find the bus or an
Mhm.
Uber or whatever. It's complicated.
Right, which may or may not be accessible, and
Hmm.
certainly it's costly as well.
Yes. Yes.
So,
Yeah.
we're always looking for ways and delighted to partner with you all on that topic as
Hmm.
well. One last thing I want to
Yeah.
chat with you just about for a couple of minutes is, I mentioned AI before. There's
Hmm.
lots of interesting technologies that are constantly coming into our marketplace. How are you utilizing AI or any other technologies to improve recovery opportunities for your clients?
Yeah, I think there's a lot of opportunity for AI with people with aphasia. We're just really dabbling in it a little bit. But we have, for example, we have one member here who uses it quite a lot. She knows what she wants to say. She has the keywords. And if she's trying to um, maybe say write her bio for something or an introduction about herself. She has all the keywords. She knows where she's from and what she did professionally. She types all those keywords in, and the more you put in, the more accurate it is, and then it generates pretty good bio. And you can edit it. And we often talk a lot about how AI doesn't necessarily pick up the personality of the writer, and how to edit for that. But it gives a starting point, and it saves her so much time, and she feels much more productive about the work
Let
she's
me
doing.
add a question into that as you're talking
Hmm.
about language. Do you have many of your clients who are not, English is not their first language?
Uh, yeah,
And how do you work with that?
Yeah, well, that's an exciting question for me to answer, because that's something we've struggled with for years,
Mhm.
and now we offer Spanish language classes, and so that's just a new thing that we've just been doing for the last 6 months or so. But we have the same communication support class that we have in English. We have one now in Spanish, and then we also have a free virtual conversation group that's led by a volunteer that's also in Spanish.
Mhm.
There's such a need for bilingual speech pathologists, and it's taken
There's
us
a
a long.
great career
I
opportunity.
know, right?
Well,
So, yeah, anyone thinking about that? And doesn't matter what the other language is, we need you. So we were really excited that we finally have been able to make that work because talk about an underserved population. It's,
absolutely,
um,
absolutely. You know,
yeah.
we know we've done some research in Northern Virginia to really look at the variety of languages spoken, and we're doing the best we can to try to reach out in
Hmm.
multiple languages
Hmm.
and help
Hmm.
people to know how to find us.
Hmm.
As we close out, because our time is just about up, um, how would you like people to be able to find you or know more about the Stroke Comeback Center?
Yeah, the easiest thing is check our website. It's strokecomebackcenter.org, and you can see all of our programs on there, and lots of information about what we do. And then if people have questions, just give us a call or send us an email. And we are always happy to talk with families about where they are in their stroke recovery. If this is the right time to join us, great. If not, we'll be here later. I often tell people, like, if you need us this week, next month, next year, our plan is to be here. So we're here. We don't have a waiting list for our programs, and we're ready to help. We're also always happy to give people other resources that they may need. It's so overwhelming to have a stroke or a brain injury, and I know people leave the hospitals with all kinds of information, and it is really overwhelming about how to navigate each step of rehab. And we're happy to talk with families and see how we can help with that, whether or not they ever join our programs. We're just happy to be a resource. So again, our website, strokecomebackcenter.org. From there, you can find our phone number and our email, and just we're here to help.
That's fantastic. Suzanne, thank you so much for joining me today to talk about stroke and about the Stroke Comeback Center. Thank you for talking about your upcoming event and how people can find out more about what you do and can support you. Thank you for doing this during Brain Injury Awareness Month. I also want our viewers to know that you can find us at Brain Injury Service. Excuse me, it's www.braininjurysvcs.org to learn more about what we offer at Brain Injury Services. We as well have a big event coming up in May.
Yeah,
On May 12th, we have our annual golf tournament. This year, we're adding in a tennis component as well, a great tennis clinic. So if you want to learn to play tennis or practice your skills, we'll have that available as well. So we hope that folks will find us and join us for both events that are
great.
happening in May. So thank you again, Suzanne,
Sure.
for
Thank you so
being with
much.
us. It was a great opportunity to learn so much more about stroke and its connections to brain injury. We
Great.
appreciate the
Thank you.
time today.
Sure.